content provided in this dental reviewer is if for educational and informational purposes only. It is not affiliated with, endorsed by, or officially recognized by the Professional Regulation Commission, PRC, the Board of Dentistry, or any official licensing body in the Philippines. All questions, explanations, and materials in this reviewer are generated using ChatGPT and are based on general dental knowledge, textbooks, and publicly available resources. This reviewer does not contain actual board exam questions and should not be considered a guaranteed way to pass the dentistry, dental technology, or dental hygiene board examinations in the Philippines. While we strive for accuracy, we encourage viewers to consult official references, textbooks, and review centers for comprehensive preparation. The creator of this content is not responsible for any errors, omissions, or exam outcomes based on the use of this reviewer. By watching and using this material, you acknowledge that it is intended as a study aid and not as a substitute for professional education, training, or official review courses.
Topic: Oral Physiology, 150 Part 2.
1. What is the period when both primary and permanent teeth are present in the mouth? A. Primary dentition. B. Mixed dentition. C. Permanent dentition. D. Transitional dentition. Answer B. Mixed dentition. Which teeth erupt first in the early mixed dentition stage? A. First permanent molars and central incisors. B. Canines and premolars. C. Lateral incisors and second molars. D. Third molars and premolars. A. First permanent molars and central incisors. 3. What term describes the transient spacing seen in the maxillary incisors due to the eruption of canines? A. Leeway space. B. Transient anterior crowding. C. Ugly duckling stage. D. Broadbent phenomenon. Answer C. Ugly duckling stage. 4. Which of the following is a normal developmental stage where anterior teeth appear misaligned due to erupting canines? A. Broadbent phenomenon. B. Early mesial shift. C. Leeway space. D. End-to-end molar relationship. A. Broadbent phenomenon. 5. The phase of mixed dent that starts with the exfoliation of primary canines and molars is called A. Early mixed dentition. B. Late mixed dentition. C. Permanent dentition. Period. D. Primary dentition. Answer B. Late mixed dentition. 6. What is the temporary crowding of anterior teeth caused by insufficient space before the eruption of permanent canines? A. Broadbent phenomenon. B. Transient anterior crowding. C. End-to-end molar relationship. D. Late mixed dentition. B. Transient anterior crowding. 7. What describes a temporary molar occlusion where maxillary and mandibular molars align cusp to cusp? A. Class 1 occlusion. B. End-to-end molar relationship. C. Early mesial shift. D. Broadbent phenomenon. Answer B. End-to-end molar relationship. 8. What is the space left by primary molars that allows the permanent molars to shift mesially? A. Broadbent phenomenon. B. Leeway space. C. Early mesial shift. D. Transient anterior crowding. B. Leeway space. 9. The mesial movement of the first permanent molars into leeway space is called A. Early mesial shift. B. Late mesial shift. C. End-to-end molar relationship. D. Physiologic drift. Answer B. Late mesial shift. 10. The early mesial shift occurs when A. The first permanent molars move mesially due to erupting incisors. B. The primary molars are exfoliated. C. The second premolars are absent. D. There is a lack of leeway space. Answer A. The first permanent molars move mesially due to erupting incisors. 11. What happens to the permanent molars when there is premature loss of primary molars? A. They shift distally. B. They shift mesially. C. They remain in position. D. They become over-erupted. Answer B. They shift mesially. 12. The term that describes the controlled mesial movement of molars to achieve a class 1 molar relationship is A. Physiologic drift. B. Broadbent phenomenon. C. Transient anterior crowding. D. End-to-end molar relationship. Answer A. Physiologic drift. 13. What is the function of leeway space in occlusal development? A. To create space for the third molars. B. To prevent early exfoliation of primary teeth. C. To allow mesial shift of permanent molars. To prevent anterior crowding. Answer: C. To allow mesial shift of permanent molar. 14. The ugly duckling stage typically occurs between what ages? A. 2 to 4 years. B. 6 to 8 years. C. 8 to 12 years. D. 12 to 15 years. Answer: C. 8 to 12 years. 15. Which of the following is a characteristic of normal mixed dentition? A. Presence of only primary teeth. B. Presence of both primary and permanent teeth. C. Full permanent dentition. D. Presence of third molars. B. Presence of both primary and permanent teeth. 16. What is the importance of the early mesial shift? A. It prevents the need for orthodontic treatment. B. It creates space for premolars to erupt. C. It helps achieve a normal molar occlusion. D. It results in permanent crowding. Answer: C. It helps achieve a normal molar occlusion. The broadbent phenomenon is commonly associated with A. The eruption of the second premolars. B. The transitional phase of anterior teeth. C. Premature loss of primary teeth. D. Development of posterior crossbite. Answer: B. The transitional phase of anterior teeth. 18. Which space allows the permanent molars to migrate forward? A. Leeway space. B. Interproximal space. C. Primate space. D. Transient anterior space.
Answer: SC leeway space.
Which of the following describes the relationship of maxillary and mandibular molars in a neutral bite during the mixed dentition stage? A. Class 2 molar relationship. B. Class 3 molar relationship. C. End-to-end molar relationship. D. Posterior crossbite. End-to-end molar relation. 20. Transient anterior crowding in mixed dentition is usually resolved by A. Tooth extraction. B. Space maintainers. C. The eruption of permanent canines. D. Surgical intervention. Answers: C. The eruption of permanent canines. 21. The late mixed dentition phase ends when A. The second molars erupt. B. The third molars erupt. C. All primary teeth are exfoliated. D. The premolars develop. C. All primary teeth are exfoliated. 22. A child with an end-to-end molar relationship at age 7 is likely to A. Develop a Class 2 occlusion. B. Develop a Class 3 occlusion. C. Have a spontaneous mesial shift. D. Need orthodontic correction. Answer: C. Have a spontaneous mesial shift. 23. What is the function of transient anterior spacing? A. To prevent misalignment of posterior teeth. B. To create space for permanent incisors. C. To maintain occlusal balance. D. To correct skeletal malocclusion. Answer: B. To create space for permanent incisors. The normal sequence of eruption in the early mixed dentition includes A. First molars and incisors. B. Premolars and canines. C. Second molars and third molars. D. Lateral incisors and second molars. Answer: A. First molars and incisors. 25. The primary factor that guides the normal transition from mixed dentition to permanent dentition is A. The growth of the jaw. B. The eruption of third molars. C. The presence of leeway space. D. The premature loss of primary molars. Answer: C. The presence of leeway space. 26. Which type of occlusion occurs naturally and does not cause harm to the oral structures? A. Physiologic occlusion. B. Traumatic occlusion. C. Therapeutic occlusion. D. Dynamic occlusion. Answer: A. Physiologic occlusion. 27. What type of occlusion results from excessive or abnormal forces on the teeth and supporting structures? A. Functional occlusion. B. Traumatic occlusion. C. Dynamic occlusion. D. Therapeutic occlusion. Answer B, traumatic occlusiate. An occlusion that has been modified or corrected to improve function is called A, physiologic occlusion, B, traumatic occlusion, C, therapeutic occlusion, D, dynamic occlusion. Answer C, therapeutic occlusion. 29. The type of occlusion that involves tooth movements during mastication is static occlusion, B, physiologic occlusion, C, dynamic occlusion, D, therapeutic occlusion. C, dynamic occlusion. 30. The functional shape of teeth plays a major role in A, determining occlusal relationships, B, creating excessive occlusal forces, C, increasing food impaction, D, promoting misalignment. Determining occlusal relationships. 31. The most convex area on the facial and lingual surfaces of a tooth is called the A, contact point, B, crest of curvature, C, functional cusp, D, occlusal table.
Answer: B in crest of curvature.
32. The purpose of the facial and lingual curvature of teeth is to A, increase enamel thickness, B, protect the gingiva and direct food flow, C, enhance occlusal forces, D, promote excessive wear. B, protect the gingiva and direct food flow. 33. Contact areas are essential for A, preventing food impaction and maintaining tooth alignment, B, increasing enamel thickness, C, enhancing occlusal function, D, reducing plaque formation. Answer: A, preventing food impaction and maintaining tooth alignment. 34. Properly aligned occlusion helps to A, prevent excessive tooth wear, B, cause anterior crowding, C, reduce occlusal function, promote crossbite development. Answer: A, prevent excessive tooth wear. 35. Excessive occlusal forces on a tooth can lead to A, traumatic occlusion, B, functional occlusion, C, dynamic occlusion, D, therapeutic occlusion.
Answer: the C, traumatic occlusion.
36. The occlusal relationship where teeth are at maximum intercuspation is called A, centric occlusion, B, dynamic occlusion, C, functional occlusion, D, physiologic occlusion. A, centric occlusion. Which occlusal concept describes how teeth interact during chewing? A, dynamic occlusion, B, static occlusion, C, therapeutic occlusion, D, physiologic occlusion. Answer: A, dynamic occlusion. The loss of contact areas between teeth may result in A, increased occlusal force, B, food impaction and periodontal issues, C, improved mastication, D, better tooth alignment. B, food impaction and periodontal issues. 39. The facial curvature of a tooth is most prominent in which third of the crown? A, incisal, B, middle, C, cervical, D, occlusal. Answer: C, cervical. What is the main purpose of occlusion in oral function? A, to enhance aesthetics, B, to maintain proper distribution of chewing forces, C, to increase occlusal trauma, D, to prevent enamel wear. Answer: B, to maintain proper distribution of chewing forces. 41. Traumatic occlusion is often associated with A, normal mastication, B, bruxism or parafunctional habits, C, improved oral function, D, increased enamel thickness. B, bruxism or parafunctional habits. 42. What type of occlusion is intentionally adjusted to improve function and prevent damage? A, functional occlusion, B, traumatic occlusion, C, therapeutic occlusion, D, physiologic occlusion. Answer: C, therapeutic occlusion. 43. A properly aligned occlusion prevents A, excessive wear and damage, B, tooth mobility, C, periodontal disease, D, increased occlusal trauma. Answer: A, excessive wear and damage. 44. Contact areas of anterior teeth are usually found in the A, cervical third, B, incisal third, C, middle third, D, apical third.
Answer: BN incisal third.
Ins 45. What is the primary function of facial and lingual curvature? Prevent occlusal wear. B. Protect the periodontium and direct food flow. C. Enhance speech. D. Strengthen the occlusal table. Protect the periodontium and direct food flow. 46. A characteristic of normal physiologic occlusion is A. Occlusal interferences. B. No symptoms of dysfunction or trauma. C. Severe crowding. D. Premature wear.
Answer. BN no symptoms of dysfunction or trauma. 47. The lingual height of contour of posterior teeth is typically found in the C. cervical third, BN middle third, C. occlusal third, D. incisal third. Answer. BN middle third. 48. Which type of occlusion is directly related to therapeutic intervention? C. Physiologic occlusion. BN traumatic occlusion. C. Therapeutic occlusion. D. Dynamic occlusion. Answer. C. Therapeutic occlusion. 49. Contact areas in posterior teeth help C. maintain proper occlusion and prevent food impaction. BN increase occlusal force. C. promote gingival recession. D. widen the occlusal table. Answer. C. maintain proper occlusion and prevent food impaction. 50. The functional form of teeth helps to C. guide food away from the gingiva. BN increase occlusal force. C. reduce enamel wear. D. create occlusal interferences. Answer. C. guide food away from the gingiva. How did you do on the mock exam? Share your score in the comments below. Thanks for watching. I hope this mock exam helped you in your review. If you want more dentistry, dental technology, and dental hygiene reviewers, make sure to like, share, and subscribe to John Ryan Magalona. See you in the next video. Keep studying and good luck on your exams.